Welcome back from that short commercial break. You're still watching Salam TV OBULAMU show. This is a health talk show whereby we discuss all the health and we tell you all about your health and your body. We bring you all the professionals just to give you an insight of your health at home, in the comfort of your sitting room, in the comfort of your bedroom, or in the comfort of your phone. Before we broke off, we are talking about the consequences of having poor oral hygiene. Doctor, how do you manage the outcome of poor oral hygiene?
Okay. How to manage the outcome of poor oral hygiene? First and foremost, before you treat a disease, you must know what caused the disease. Yeah. When you know what caused the disease, you will get the way of treating the disease. If you know that you really got the disease as an outcome of poor oral hygiene, you need to improve your oral hygiene through the following ways. If you have not been brushing, flossing, you start regularly. Then another thing, you have to floss. Flossing is different from brushing. There is those flossers with, unfortunately I didn't come with it here, but they help to remove the food particles.
It is like a string.
Yeah, it's like a string.
It's like a string. There are those which look like, but it uses a thread. You know, some people say they don't know how to use it, but that's what it is. I wish I had carried one. But it is like a string. That's what they call a floss. Some of them are scented, some of them are sweet. Some of them have meat. And it feels good to use it, but it goes between
the teeth.
Yes.
Between the crowns of the teeth to remove the food particle that would stick here.
Okay.
Yeah. Then another thing, is to avoid sugary foods, as we had already talked about it.
Okay.
Then another thing is to ensure that you have you avoid the dry mouth. You know, dry mouth is also a very good cause of hysteresis or bad smell.
We talked about it when that oxydikenyu.
Oxydikenyu.
You keep quiet, like as if you are sleeping.
Yes.
That's why you wake up in the morning and you have that.
As a result, you find your mouth is full of yeast. The bacteria itself has already accumulated there. First and foremost, you are breathing. The carbon dioxide from your body is hitting on the palate of your oral cavity. It will be having that moisture that is going to stick here.
So you are trying to say that our viewers should be there like talking, yapping all the time.
Of course, not talking, but you should ensure that at least you let the carbon dioxide get out freely. Yeah, not enclosing your mouth 24/7, which may result into that we are talking about.
Okay. So, that's all?
No. When you have a damaged crown, you can go through crowning. You get an artificial crown, which is better because it is really permanent. You get it, it's permanent, but it's done after doing your root canal. You know, when you get a crown damaged, the bacteria goes inside and affects the pulp. That's when you start feeling that sensitivity. You're feeling a lot of pain.
The pain.
Yeah. So when they do root canal, they remove those like bagamanti elinyo balise. Bajjemu emiswa iliye badde emirwadde. Then they cover it with a crown that will there is what they call occlusion, that will enable the proper occlusion, that you completely occlude very well over okugata amanyogo like normally. So that's one way of preventing a further affection of the tooth.
Okay.
Then another thing, you do what they call scaling and polishing. That is done in clinics. Scaling and polishing, there is a specific machine that we use to scale. Okujako plaque, okujako bacteria, okujako food particles.
Chita kabole. In Luganda, it's called kabole.
Then you do scaling, you polish, as one way of improving your oral hygiene. Yeah.
Okay. Thank you so much. We are hosting Dr. Mugarura. He is a dentist, and today's topic has been oral hygiene, which really is a big concern to everybody. Says everybody, we all have a mouth, and we all use our mouth, and I practically love mine. because I have my reason as to why I love my mouth, because it's a weapon on its own, and I love my mouth.
Absolutely.
Tell us, there are some things in life. For example, me myself, I don't eat garlic. I do eat it, but not live. I can't eat live garlic. I can't eat raw onions, because even cabbage, rarely do I eat raw cabbage, because after eating it, you feel that smell. What do you advise your viewer today about the nutrition someone can take, the do's and don'ts of nutrition when it comes to oral hygiene?
Okay. Thank you so much, Madam. The foods that you've been talking about that are important in our bodies, if a nutritionist is come here, he will explain to you very well.
I
and
know.
surely you understand that they are very important. And
I know, but I just have that.
But they have
feeling.
a very strong odor.
Yeah.
That even if you touch it, you will feel it. You go smelling that same odor. But you cannot dodge them, because they're important in your body. They're needed. But you ensure cleaning after. You ensure the proper cleaning.
You will have the smell of garlic on you for a week when you eat it.
But you ensure the proper cleaning, and odors are removed by the odor. I hope you can have you have taken garlic, it's causing a very bad smell or hysteresis in your mouth. You can have a chewing gum with the strawberry flavor.
So you bring something which can cover up.
That can cover up. Sometimes in our life we need to be creative. Yeah.
Okay.
But I do not say that you eat and you don't clean, then you kwei. No. You clean, then what has refused to go directly, maybe like immediately after cleaning, you apply something to reduce on that bad odor.
Okay.
But and in addition to what to what I've not talked about, it's indenturism. Indenturism, that's when you then you tell the person, remove. Most of the people result into extraction. And extraction.
Yeah, by the way, when we were growing up, that was the order of the day. You say my tooth is paining, you just go to a dentist. But
do you know that the teeth are important on your jaw relationship?
On the designing your
the
jaw.
shape. Here, when you talk about the anteriors, these ones, they're the corners of the shape.
These ones here.
The canines. They're the corners of the shape.
They define the beauty of your face.
Yes, they define the beauty of your face. So when you have them removed, you have the mouth deforming, because you undergo what they call jawbone. It will resolve, like it ligwao egumba lyo ligwao no gena munda. Then when this one, like you have removed these ones will grow longer to cover up the space. Naturally. They only grow at a certain pace because they are being prohibited by this to encourage a proper occlusion here. But when these are not there, trust me, these will grow. And they will damage the gum.
What they call vampires. They are in movies. I don't think those things do exist. Those are illusions which were created just for entertainment sake. Thank you so much. What is the importance of water in our daily life, especially in relation to oral hygiene?
Water is very important. One, it removes the food particles from the taste buds on your tongue. Two, it softens the oral tissues. When the oral tissues are dry, it might even be difficult for you to talk. Because the tongue muscles, those languages are going to confuse the people.
No, you say it. I'll give you an example of a dry mouth.
So we have the businge muscles, the muscles of the cheeks. When you do not have saliva, you end up having that dry oral cavity. Trust me, they will not have the proper counteraction with your teeth, you may end up having a deformed jaw, or you may end up having unhealing wounds because of the lack of water or saliva in your mouth.
Usually, I have ever experienced that, a dry mouth, and that bajita, they call it enkalamata, the thirst.
Yeah.
You feel that thirst
Yes.
in the mouth. When I was from the theater after an operation, there's that drug they gave you, and it makes you feel dehydrated completely, and also, and good enough, they allow you these days. They tell you take a glass of warm water. You start slowly, and my judge used to tell me, when someone has been fasting or someone has spent time and he's not eating or drinking, they usually give you ghee. Baguyita omuzigo ogw'ente, amajita. Is that how
Yeah, that's
omuzigo gw'ente. You melt it and give it to someone. It is very smooth here.
Yeah.
And it cures that really.
It cures it because it's soft. And like it makes a slippery media on those dry surfaces.
Okay.
Like when you have a wound, you would be given a Vaseline to smear on it, so that the dry parts could drop off, and you encourage the generation of the new skin cells. Yeah.
Thank you so much. Doctor, tell us about the few procedures which are done in the hospital by dentists.
A few procedures.
A few, especially to correct any dental issue. Apart from, we have heard about kukula, that is the toothing, removing. What other procedures do you do in the hospital?
We do different procedures basing on different cases that a patient has. One, you might have a malalignment of your teeth
Bazita
on the arch. Yes. Let me say this teeth has gone inside, this one has come out. That one you will have.
Another one is growing from the other one.
Yes, exactly. That one you have to get braces, like to align them on the arch to get a proper arch, like the way you see this model.
Okay.
Then when you have cavities, tukola kino kyemutera kuyita okusementinga. Kuteekamu cement.
Naye abeerawo ono muhadi we oba?
No, it's a dental material. not on our cement. Rather owa hardware gwe muzimbisa. Buli kimu kyonna kye tukozesa mu kamwa. Specifically for the oral cavity.
Okay.
There's nothing we borrow from outside, then we bring into the oral cavity. Because here we are dealing with human beings. You might bring something that is toxic. Yeah.
Okay.
Then before cementing, you need to do root canal. Because surely, erinyo bwe liba lifunye hole, bacteria egenze munda. Tosobola kugibikira wano, and you close it inside.
It will continue eating.
It will continue eating the
up
jaw.
To the jaw. Up
to the jawbone. It will continue eating, causing the blood poisoning, the one I was talking about, and the person may end up dying, losing a patient. What you do root canal. That's another procedure that we go through. That is, of course, surgery. Then after that, after doing root canal, you can either decide to make this tooth, the natural tooth you had, as an abutment. Abutment, you leave it there, support the artificial tooth that you are going to put the crown. Or you may cement that same crown, the artificial one, the natural one, depending on the choice of a patient.
Okay. Okay, as we finish our show, we have some questions.
Scaling.
Scaling. What is scaling? Scaling is kujjako ebigundi by'ekyennyanja.
Ante ebigundi by'ekyennyanja, even here in your teeth can you also get those dirty things. But you scale it using that car machine that we use. Then after you polish, that's another procedure. Scaling and polishing. Yeah. Okay. That is all. We have a Q&A. Questions our viewers have been asking. Between toothpicks and floss, what is the best to use? Floss is very, very, very important. And I do not say that toothpicks are not good, but of course we do grade depending on how useful the thing is. Toothpick is it's kinda harmful if misused. You might affect your gingiva and you result into gingivitis, which is one of the periodontal diseases. But a flosser, another thing, a toothpick does not enter
in between
to remove that small stain that has stuck here between the crowns of your teeth. But a flosser can.
Okay. Is chewing gum safe?
Chewing gum, yeah, it is safe, but you must be careful which type of the chewing gum you are taking. First, I'm saying it's safe because as you chew, you stimulate your salivary glands to secrete more saliva that are important for your oral cavity.
Okay.
Though chewing gums may result to ulcers.
Yeah, I know.
You are chewing, you are swallowing nothing.
You are preparing your stomach to receive food.
Yes, the enzymes are active. So you might develop to that. So that's one of the side effects, the negative side effect of chewing gums. Yeah.
Is it safe to use a mouthwash?
Yeah, it is.
Okay.
Because those mouthwash, most of them, they contain antibacterials. Yeah, that may help you to kill the bacteria in your mouth, in your oral cavity.
Okay. There is a certain word, there is something which is being used these days. And in fact, I hear someone is going to do a festival, but there is a brand. There is a word I'm going to use, but I'm going to describe for you what it means, because you might not know. There is a leaf, it's a plant, and it's eaten by men, and it is branded Enkwacho. You know that? You have ever heard that?
I think I've seen it on media.
Mira?
Mira?
It is called the Mira or something like that. It's a drug.
It's a drug. Yeah, I think I've seen it on media. And
What challenges do dentists have with people who take Enkwacho?
Yes, you know, people do take things not knowing that they are affecting them. I would relate that Nkwacho to tobacco use.
Yes.
Yeah. Those
because it's also addictive, actually.
Yes, it's addictive. One, it will deaden your teeth. Another thing, those plants have different, like tobacco has gotten nicotine. It has strong acids that can end up affecting the crown.
Okay.
It has strong acids that can affect your gingiva, developing into gingivitis.
The last one, last two. Is it safe to work on a pregnant woman who has a tooth problem?
It's kind of not safe because the pregnant people always, most of them, you find them, they're diabetic. Yeah.
So even a diabetes patient doesn't see?
Yes, because, for example, you want to do extraction. A diabetic patient really takes long to heal. Another thing, you need to do anesthesia. And you might find it may cause a side effect to the diabetic person.
And the pregnant woman. And
the pregnant woman as well. So you need to be first to know the history taking. You do history taking on a patient. Have you been this? Is this allergic to you? Yeah, before you do the procedure. Okay,
in 1 minute, we are going to, as we close the show, I want you to give the last advice you can give your viewers right now. You tell them where they can find you. I don't know whether you're comfortable giving out your number, because you might get floods on your phone and you might have issues. So it is your liberty. Either to share your number.
As a medics, we are like soldiers. First of all, we give ourselves for people's lives. So, and surely you cannot light a candle and you cover it with a basket. Okay. I'm okay with it. Share your number then. It is 0707 860 333. 333. Yeah. Okay. Where do you work from? Baker Dental Clinic. Just opposite Makere, Minigate. Ham Towers. That is Ham Towers. Yeah. Okay, say good night to our dear viewers. Yeah. Very happy to have been with you here today. And the last advice I can give you, you should know that your oral cavity is very important for you, and it's very crucial because as we have seen, it can cause you heart diseases, can cause respiratory. Do you know that it can also affect your reproductive system?
We'll discuss that later. When you
Yeah.
talk about reproductive people's reproductive, that is very, very sensitive.
So it's very, very sensitive. So avoid bad habits like smoking, regular cleaning, and ensure your proper hygiene of your oral cavity.
Thank you so much. That has been Dr. Mugarura. He's a dentist, and you can get him at Ham Towers, opposite Makere Main Gate.
Yes, Becker Dental Clinic.
Becker Dental Clinic.
Yeah.
Thank you so much for those people who have managed to see this show. And we really appreciate everybody. Me and my crew, we are here to tell you good night and thanks for keeping it Salam TV. And we're wishing you a very good night.